Good evening, my name is Adi, and my presentation is based on hypertension. In my presentation, I'll be discussing what hypertension is, clinical manifestation, nursing consideration, treatment, and many other things, including risk factors. So, a lot of people, about 78 millions of people in the United States is being affected by these diseases, known as hypertension. One in every three adults is affected. Half percent of half percentage of millions were the people within the uh, limit of this cardiovascular disease known as hypertension. So what is hypertension? Hypertension, a state in which the force of blood against the arteries wall is too high. Hypertension is defined as blood pressure above 140 over 90. It's also considered as severe 140 over 120. Hypertension can lead to several health complications and increase the risk of heart disease. Why hypertension is called silent killer? Why is it called silent killer? It's called silent killer because it may show no symptoms. Blood pressure is reading in two numbers. The first systolic number represents the pressure in the blood vessels. When the heart contracts or beats, that is what we call systolic. The second number, called diastolic, represents the pressure in the vessels when the heart rests between beats. The high normal blood pressure is 130 or 139. Normal blood pressure less than 130. Grade 1 hypertension is 140 to 159. The second grade hypertension is over 160. The etiology of hypertension. Hypertension is the most common primary diagnosis in the United States. It affects approximately 86 million adults in the United States. The major risk factors for stroke, myocardial infarction, vascular disease, and chronic kidney disease. Primary hypertension accounts for 90% to 95% of adult cases. A small percentage of patients have secondary causes. Primary hypertension has no unknown causes. The secondary hypertension is the side effect of another systemic disorder such as crushing disease, kidney disease, or hyperhidrolism. Treating the systemic disorder will lower blood pressure in secondary hypertension. What is pathophysiology of hypertension? Pathophysiology is diseases of this abnormal of hypertension. Hypertension has two major causes on the vascular system. One, it apply high damage forces against the endothelial lining of the arteries. Hypertension also causes high resistance against the heart's left ventricles. What are the clinical manifestations? Hypertension is silent, gradual process that most commonly has no symptoms until it causes damage, dysfunction. The target organs of hypertension are the heart, brain, extremities, retina, and kidney. Symptoms are chest pain, palpitation, headaches, vision disturbance, dizziness, weakness in an extreme, leg pain, also edema. What do I mean by edema? Edema is accumulation of fluid in the body, which indicates organ damage. What are the complications of hypertension? Hypertension is responsible for damage to target organs, which include the heart, retina, kidney, brain, and arteries. When it is not well controlled, it contributes to the development of hypertensive heart disease, heart failure, retinal failure. Also, hypertension is major contributing factor to fatal intracerebral hemorrhage. What are the risk factors? Age, race, family history. Family history is it runs in the family. It runs if both parents has hypertension or if one of them has an hypertension. Likewise, it's going to transfer to the son or to their offspring. Obesity. What do I mean by obesity? That is increment of fat in the body. This is determined by the height and the weight. When the BM is the body mass index is if it's greater than 30, is considered as obesity. Smoking, excess sodium. What do I mean by excess sodium? You know, people when they go to restaurants, they always ask, "Oh, I need a table salt." Table salt, that is a raw salt right there. It's not good. Taking it is not good. So excess salt is increase the blood pressure. Insufficient potassium in diet, insufficient vitamin D in diet, excess alcohol. What do I mean by excess alcohol? When people drink alcohol too much, it affects the blood vessels and the blood will be resisted. So the blood will not be able to flow into to the liver, which causes cirrhosis, that is liver damage, and also increase hypertension. What are the treatments of hypertension? Lifestyle changes can help control high blood pressure. Lifestyle changes can help control high blood pressure. Also to reduce the risk of life-threatening complication. Number one, a low-fat diet, reduce stress, increase physical activity such as exercise. Medication, avoid or quitting smoking, avoid alcohol consuming. What are the nursing considerations? Nurses' assessment must involve careful monitoring of blood pressure at frequent or routine scheduled interval. Measure weight weekly or monthly. Also, assess for headaches, dizziness, fatigue, weakness, and decreased exercise tolerance. Then you also have to teach your patient to avoid what triggers or that may cause anxiety, stress, and anger. When people get annoyed, it increases blood pressure. What people can do, people that are hypertensive, they should avoid anger. When anger comes in their ways, number one, either you walk away from anger, you exercise, you breathe, you relax, you do some reading, you watch movies. In conclusion, hypertension is real, it's a silent killer, and it's deadly. Regular checkup determine high blood pressure. Study your blood system, study your body system, and report abnormal findings to your doctor. Lastly, maintain healthy weight. Take care of yourself.